So, Natasha, thank you so much for agreeing just to have a bit of a chat to give us some insights about your experience as a physiology student.
That's all right.
So, my name's Chris Ward. I'm a professor of respiratory physiology, and I teach physiology. So, I've had the pleasure of teaching Natasha, and now that she's got her results, it's really interesting to talk to students about their experience. So thanks again, Natasha. And so my first question is, can you tell us about your interest in physiology, and how did this help you to decide about studying physiology?
Yes, so at school, I always had a greater interest for biology over chemistry or physics, in particular human biology, really. And then a bit of further research and my desire to work in a clinical setting, I initially decided to do biomedical science. However, after the first year modules and having an experience with physiology, I decided that's actually where my passion lay. And then further to that, like wanting to be a cardiac scientist, really, it just led me to choose physiology overall.
Yes, I see. So, and that makes perfect sense to me, because as a physiologist who does teaching and does research, I find the most fulfilling part of my job. Well, the teaching is great, but also being able to sort of work with clinical colleagues at the RVI and the Freeman Hospital, and to put the physiology into practice.
Yeah.
It really is quite close to patients. So could I ask you about the degree program? I mean, we've lived through an extraordinary couple of years, you know, could I ask you about the degree program, and perhaps anything that you enjoyed about it, really?
Well, to be honest, I think I've learned beyond what I expected, in terms of like depth. Like I never would have expected to, like learn what I did. I would say one of my most enjoyable things was maybe the anatomy module and those practicals, being able to actually examine like full human cadavers and hold like human brains and things like that. I just found things like that fascinating.
Yeah. So anatomy really is fascinating, isn't it?
Yeah.
You know, because it underlies the function of the human. Yeah. So, one thing that we're proud of in Newcastle, I think, as a university, is the opportunity for a final year research project. Now, it's challenging. It pushes people, I think. But could you say briefly about what your research project was, and what skills you think you developed, and perhaps why you enjoyed doing a physiology related project?
Yes, so my project was based on using serial block-based scanning electron microscopy to investigate capillaries of both cardiac and retinal tissue, which was very interesting. I'd say the main skill that I developed was my ability to analyze scientific papers and then utilize that information within my own research. So yeah, like independent study was like a big key thing. And then I also would have obviously improved my writing skills, because I've never really written in like a literature, like scientific paper format before. So that was good. Yeah, and it just really like enhanced my enthusiasm to pursue a career in physiology. Just it showed all the different directions that you could take the degree in.
That's fantastic to hear. And you know, when you were reading the previously published papers, Natasha, did you ever find flaws in them, or things that you would think, oh, that could be done better? You know, ideas for the future, sort of thing. Or
Yeah.
Sometimes you spot mistakes. In papers.
Yeah, I think especially the older papers, having like what we know now, looking back, you just see, oh, maybe that was slightly.
Yeah. Yeah. So the the process of research is a continuous one, and that should really inform. That should be put straight back into the teaching, I think, personally. Yeah. So so I wondered, Natasha, what encouragement or what words of advice might you have for people who are thinking about doing a physiology degree and wanting to do physiologically related projects? You know, people who may be thinking, well, I don't really know what physiology is.
I would say if anyone has a passion or a desire to explore like the functions of the human body, then I'm sure they would find physiology absolutely fascinating. I for one did. And I think the course does offer something for everyone. I've not spoken to a single person who has regretted their choice to take physiology. And yeah, we've all just really enjoyed it. Yeah.
That's really nice.
Yeah.
Really nice to hear. And in doing the teaching, sometimes you teach to a lot of people, you know, sometimes hundreds of people. With physiology, it's different. It's smaller. And what I was finding was that, because a lot of it this year was done on Zoom, of course. What was nice was that people felt confident enough to put their cameras on, so that you're actually talking. It was more of a conversation.
Yeah, that's what drew me to it initially, knowing that a smaller group, you could more openly have those questions, whereas in a big lecture theatre, it's more difficult to ask your individual questions. Yeah.
And that is so much helped by. It can, with the pandemic has made life difficult for everybody in the world. Students have had a hard time, and I can imagine reasons why people sometimes wouldn't feel like putting their camera on. But it's been nice to have that ability to connect. I think, you know, despite what's being thrown at the system. And I think the student body has done remarkably well to do what they've done. One last question, Natasha. What are you up to next?
Well, currently I'm seeking some clinical experience to be able to put down on my application to hopefully apply to be a cardiac physiologist in the future.
Yeah. So well, the heart is important because it pumps blood to the lungs. Yeah, that's my sort of physiologist joke, but of course that's great to hear. So well, thank you very much for your time, Natasha, and you've done a great service, because this will be a video made available to prospective students. And it's nice to hear from somebody who's part of their group, rather than somebody who's, you know, a bit old and out of touch. So,
Yeah.
so thank you.